Hi, I'm Dr. Larry Malerba, and welcome back to All Things Homeopathy. Today I'll be talking about the homeopathic treatment of pharyngitis, or sore throat. Now, it's important to understand that it's not possible to use homeopathy to target a symptom and treat it in isolation, as if it can be separated from the rest of the person. Homeopathy is not like conventional medicine, which often treats the different symptoms of a person with different drugs, like when we give one drug for throat inflammation, another for fever, and another for nasal congestion. However, the symptoms of a sore throat can serve as guiding clues that enable homeopathy to treat the overall condition of the sick person, especially when the throat symptoms are particularly prominent, striking, or severe. For example, one person with mononucleosis has a variety of symptoms, including severe fatigue and a scratchy throat. In such a case, the scratchy throat may not be a particularly helpful clue. The proper choice of remedy may require that we place more emphasis on the fatigue. Another person with mononucleosis also has fatigue, but his sore throat symptoms are particularly intense. In that case, the throat symptoms may be useful in choosing a remedy that suits the overall illness. In other words, a successful prescription should bring rapid relief to both the sore throat and the mononucleosis. With that said, let's take a look at some of the more common pharyngitis remedies and their symptom patterns. A belladonna sore throat is usually associated with sudden and rapid onset of high fever, especially around 3 p.m. The throat is hot, dry, and noticeably red, oftentimes bright red. The throat may be swollen and can burn. The pain is worse when swallowing, and the throat may constrict upon swallowing. Sometimes the throat symptoms are worse on the right side. Additional associated symptoms include bright red face, dilated pupils, and lethargy. Belladonna is often described as having a glassy-eyed appearance, meaning that the person has a dazed, far-away look with a fixed, expressionless stare. We may see this in the case of delirium caused by high fever. Another concomitant symptom can be the famous belladonna strawberry tongue, which means that the tongue is red, swollen, and bumpy, like a strawberry. This symptom is often present in scarlet fever. The belladonna keynote symptoms are suddenness of onset, redness of parts, and intensity of symptoms. The mercurius sore throat is often recognizable by its associated sick mouth symptoms, like bad breath and a bad taste in the mouth. A parent may notice a child's sick-smelling breath. The bad taste is usually described as a metallic taste, like the taste one gets from putting a copper penny in the mouth. The throat is raw, the tongue can be coated, and there may be swollen glands. There's excessive salivation, which is often confirmed by the fact that the patient drools on the pillow during sleep. The excess saliva may also create a need for frequent swallowing, which is painful and aggravates the sore throat. There can be suppuration or pus formation on the tonsils, and there may be ulcers on the tonsils or elsewhere in the mouth. There's a thirst for cold drinks, even though cold may aggravate the throat pain. Of course, we often see the famous mercurius thermal sensitivity. Like the mercury in a thermometer, the mercurius patient is sensitive to every little atmospheric change. There may be clammy perspiration, and the patient complains that he's hot 1 minute, cold the next, and then hot again. Over the years, I've found that this mercurius symptom pattern, with its prominent sick or septic mouth symptoms, is often the result of the repeated and excessive use of antibiotics. The main tip-off in a Hepar sulf sore throat is the intensity of pain and tremendous sensitivity to cold. The throat is very painful, more painful than most other types of sore throats. Oftentimes there's a sharp stitching pain that is worse on swallowing and that extends from the throat to the ear when swallowing. Alternately, it may be described as a sticking pain, as if there is a splinter in the throat. The Hep-R sore throat can be left-sided and is worse from any kind of cold exposure, whether it be a cold drink or even cold air. Conversely, the sore throat and Hep-R symptoms in general tend to feel better from warmth. The person who needs Hep-R is generally sensitive to all forms of cold, including cold drafts of air, cold drinks, and especially cold, dry wind. In fact, Hep-R type illnesses are often precipitated by exposure to cold, dry wind. The accompanying mental state is usually one of great sensitivity and great irritability. In summary, the Hep-R sore throat involves great pain, extreme sensitivity to cold, amelioration from warmth, and emotional irritability. Now, lycopodium is famous for symptoms that begin on the right and then move to the left. And that's exactly what we can see in a lycopodium sore throat. It can be indicated for a strictly right-sided sore throat, or a sore throat that is worse on the right than it is on the left, or a sore throat that begins on the right and then extends over to include the left side, or a sore throat that begins on the right and then switches sides so that it affects only the left side. The lycopodium sore throat can be either ameliorated or aggravated by cold drinks, but it is most often aggravated by cold drinks and ameliorated by warm drinks. The other well-known lycopodium modality is aggravation from 4 to 8 p.m. And so it's possible that an illness and its accompanying sore throat symptoms may become worse during this time frame. And finally, lycopodium is prone to digestive complaints. So it's not unusual to see concomitant digestive symptoms like gas, bloating, indigestion, belching, or flatulence associated with a sore throat. In summary, a lycopodium sore throat moves from right to left, is worse from cold and better from warmth, and may be accompanied by digestive distress. Now we can think of lachesis as essentially the reverse of lycopodium. The lachesis sore throat begins on the left and may extend over to or switch to the right. The temperature modality is also the opposite of lycopodium. The sore throat is aggravated by warm drinks and ameliorated by cold drinks. It also happens that lachesis and lycopodium are complementary remedies, which means that they're sometimes given in sequence during the course of treatment. Lachesis has a reputation for its many throat-related symptoms. There may be a constricting or choking sensation, or a feeling of a lump in the throat. The external throat is sensitive to any kind of pressure, even the touch of clothing. Oddly, sometimes the throat is bothered more by swallowing liquids than it is by swallowing solids. A prominent lachesis modality is aggravation of symptoms after sleep. The sore throat, therefore, may have its onset on waking in the morning or may feel worse after a night of sleep. The lachesis mental state is one of irritability and mistrust. He or she may refuse help when it is offered and may be suspicious about taking any medicines, whether allopathic or homeopathic. The key feature of an apis sore throat is edema. Think of a bee sting and its characteristic swelling, redness, heat, burning, and stinging. The tonsils can be hot, red, and swollen, and the pain is often of a burning or stinging quality. Oftentimes, the right side of the throat is affected more than the left. And as with lachesis, the pain is aggravated by warmth and soothed by cold. Sometimes there's no actual swelling, but simply a sensation of swelling. Apis is the main remedy to think of when there is a swollen uvula, which is that blob of soft tissue that hangs from the back of the palate. When the uvula is so edematous or swollen that it threatens to obstruct the throat, think of APIS. Generally speaking, the person who needs APIS tends to feel warm, is aggravated by warmth, is lacking in thirst, and is emotionally irritable. There are some unusual clues that point to the phytolacca sore throat. One is that the throat pain is aggravated from motion of the tongue or when sticking the tongue out. The throat pain may extend to the root of the tongue or to the ear on swallowing. Another clue is that the sore throat may be concomitant with or accompanied by a stiff neck. The sore throat, stiff neck, and swollen glands and tonsils are more likely to be right-sided. Sometimes there's a sensation of a hot lump stuck in the throat, and the throat pain tends to be aggravated by warm drinks and ameliorated by cold drinks. We think of lac caninum when the throat pain alternates sides, as in first it was on the left side, then the right side, and then the left again. Like lachesis, touching the external throat can aggravate the throat pain. The throat pain may extend to the ears on swallowing and usually feels better from cold drinks. We think of Mercurius iodatus rubor when we see symptoms that remind us of Mercurius, but the sore throat is distinctly left-sided. Similarly, we think of Mercurius iodatus flavus when we see symptoms that remind us of Mercurius, but the sore throat is distinctly right-sided. The nitric acid sore throat, like the Hepar sore throat, is characterized by a sharp sticking pain, as if there's a fishbone stuck in the throat. And like Hepar, the pain extends to the ear on swallowing. But the nitric acid sore throat is usually not as intense or severe as the Hepar sore throat. Additionally, nitric acid, like Mercurius, has a strong tendency to develop sores and ulcers in the mouth and throat. But the real difference is in the mental state. Nitric acid tends to be very anxious about his condition to the point of hypochondriasis. He needs frequent reassurances that his illness is not serious or terminal. Now, the person who needs arsenicum also tends to be quite anxious about his condition. The sore throat is of a burning quality, is aggravated by cold drinks, and better from sipping on a warm drink. Arsenicum is generally very chilly, and his anxiety tends to intensify when alone and at night, especially between midnight and 2 a.m. Fever and/or chills may also spike from midnight to 2 a.m. In fact, many arsenicum illnesses tend to have their onset during this same time frame. And finally, the rus-tox sore throat is often brought on after exposure to cold, damp weather. It tends to be left-sided, worse in the morning on waking, aggravated from cold, and better from warmth. The person who needs rus-tox tends to be physically restless and, like phytolacca, may have a stiff neck, except the rus-tox stiff neck is usually on the left side. Now let's review by summarizing each of these symptom pictures in a few words. For belladonna, sudden onset, high fever, great redness, 3 p.m., strawberry tongue, right-sided. Mercurius, bad breath, metallic taste, excess saliva, pus formation, hot and cold. Hepar sulf, extreme pain, sharp pain, very chilly, cold sensitive, irritable. Lycopodium, right to left, worse 4 to 8 p.m., digestive concomitants. Lachesis, left to right, worse warmth, better cold, aggravation after sleep, throat sensitivity. Apis, swelling throat or uvula, redness, burning, stinging, worse warmth, lack of thirst, right-sided. Phytolacca, worse from motion of tongue, stiff neck, right-sided, better cold drink, worse warm drink. Lat caninum, alternating sides, worse touching external throat. Merc IR, like mercurius but left-sided. Merc IF, like mercurius but right-sided. Nitric acid, sticking pain, sores and ulcers, hypochondriacal anxiety. Arsenicum, chilly, anxious, burning pain, better warmth, worse midnight to 2 a.m. Rustox, worse exposure to cold, damp, restless, left-sided, and stiff neck. Okay, there you have it, some of the main remedies for the homeopathic treatment of sore throats. If you enjoyed this presentation, please subscribe to the ATH channel, and I hope you'll tune in again to the next episode of All Things Homeopathy. Until then, may the vital force be with you.